Canker in racing pigeons. The disease canker is caused by a protozoan Trichomonas columbae. This is a microscopic single-celled organism. It infects the digestive tract of pigeons. The organism, Trichomonad, requires intimate contact between birds to be spread and is usually transmitted by saliva or pigeon milk. Saliva contaminates food and water. As a pigeon drinks, the organism swims away from its beak and, when another pigeon comes to drink, it not only drinks the water but also the trichomonads. Trichomoniasis, pigeon canker, is the most common disease of pigeons. Approximately 80% of pigeons are infected with this organism. The organism is a microscopic flagellate classified as a protozoan. Different strains, Trichomonas gallinae or Trichomonas columbae, vary greatly in their ability to cause disease. Symptoms of canker disease in pigeons. Repeated swallowing movements can be a sign of canker. I usually notice this after the birds land on the loft, after the training. Yellow stuff in the throat and beak of the bird, ruffled plumage, weight loss and weakness, increased water intake. This also produces the so-called wet nests, when the parents having canker pump a lot of water in the nestlings and the birds are reluctant to fly. As the infection usually affects the beak, throat, crop and esophagus, birds have difficulty eating, drinking and swallowing. This can result in regurgitation leading to starvation and sometimes choking. A throat swab is used for testing with a microscope for canker. You can get these from your avian testing vet. It's simple to do and advisable before treating with any medication. Prevention. Use apple cider vinegar at the dose of 1 to 5 ml per 1 liter of fresh water, especially when you can't remove the water for many hours after feeding. The parasite can't survive in acidic water and apple cider vinegar drops the water pH to about 4 to 5 at the dosage above. You can buy pH testers and it is advisable to do a water pH test after applying the apple cider vinegar because you might need more or less vinegar per liter depending on the pH of the water in your area. Treatment in the water. Ronidazole is the most commonly used medicine in treating the canker in pigeons. Or alternatively, metronidazole is a generic form of flagyl which helps with the treatment of avian canker, trichomoniasis. Both treatments work well. Individual treatment. Spartrix is a one-tablet treatment for canker. It is important to treat parent stock before mating, as canker can be passed to the young when feeding.